Dr. Jha, you had your hand up. Go ahead, sir. Do you accept these numbers?
I accept these numbers, and in fact, the Indian government's release of the civil registration data in 2020 corroborates the WHO estimates for 2020. And let me explain how. There were 8.1 million deaths in 2020 recorded in the CRS. If you compare that against the average of the 2 previous years, you shouldn't compare it against 1 year. That's cherry picking. Compare it against the average of the 2 previous. The difference is 0.8 million deaths.
Okay.
What is the WHO's estimate for 2020 deaths? It's 0.8 million deaths. What is our estimate based upon the national polling data? Well, it's 0.6 million deaths, but we only covered 8 months. So the CRS release of yesterday and my esteemed colleague, Dr. Vinod Paul's editorial does not refute the WHO numbers, it corroborates them, at least for 2020. If the Indian government wanted to get to the truth of what is going on, then release the civil registration system data by week, not so you can look exactly during the peak months, peak weeks, was there an excess? And one more statistic before I hand over the floor. If you use that same metric, then let's look at Maharashtra. Maharashtra had a 19% excess of 2020 versus earlier deaths. The Indian average was 11%. So, and that's exactly consistent with the WHO numbers. And we all know in 2020, Maharashtra was particularly hard hit.
Right.
So the Indian government's own data is corroborating the WHO estimates, at least for 2020.